This video is me assessing and treating a cyclist with shoulder and arm numbness. So just so you know, this is not his first treatment. This is our first time in the clinic working on this, but I had given him some exercises. He was making progress, but I felt like we needed some hands-on clinical time and a little more in-depth assessment. So that's what this video is. So just know this is not the whole picture. But if you want to see more videos like this, please like and subscribe, and I can make more videos like this. Also leave a comment below of what you want to see, and also know this was always with consent. Can you bring your arm up, like straight up in front of you, all the way up, and then come back down. And then let me know if any of these movements bother you. And then face your palm towards the window. And then bring your arm down. And then we're gonna...
like this?
And then don't bang it on the counter, but can you go to the side and all the way up? Come back down. Does that bother anything?
No, no pain whatsoever.
And then, okay, I have to show you this because I can't. I don't have enough words. Can you do this? Bend your wrist back, like down. That's all you got. Okay. Now bring your head. Does that make any tingling?
No tingling, but it cracks a little.
In your neck?
Yeah, but me.
Okay. Okay, but that doesn't bring any tingling. What about with your hand? Can you make it go like this and then bring your head away? Any tingling?
No.
Okay. How about bring your head back to normal?
Okay.
Can you turn to one side and then turn to the other? Do that again. And then go the other way again. Does that feel tight?
Yes.
Which side? Both sides?
Tighter on this side.
Yeah, I see that. Can you go to the side? And how about this side? What about that?
Now that's tighter on this one.
Okay. How about looking up and then look down? Anything?
No, it's still like right here, but it's not pain or anything.
It's gonna sound weird. When you look up, you do this.
Okay, so I should try and look straight up?
Yeah. You still kind of do that. It's interesting. Okay. And then one more time, go sideways. And then go the other side. Yeah.
Still kind of restricted on this side.
Everything is sort of like you're trying to open that side. Yeah, I think it's from your neck, honestly, because this is the nerve test, this is the nerve test, but I think it's mostly from your neck. So we're gonna work on your neck.
Okay.
Okay, now we're gonna work on the shoulder after the neck. We found some good tightness. Okay, relax. Relax. Make this arm heavy. There you go. This is the hardest part for people. So what I'm doing, these are called shoulder mobilization. So kind of like the joint, basically the opposite of like when you're in the cycling arrow position. This is all closed off. So trying to open this up and see if that will like give you some relief too. And this patient's already doing a home exercise program of strengthening rotator cuff in the back. You okay? I'm laughing at your shirt. You wear a nice clean shirt for that. You didn't know you were going to be on camera. We're going to cut this out. In this part of the video, we're retesting afterwards. Sorry, the original audio got cut off, but I'm looking at turning his head side to side. How does that feel? And then looking up and looking down. And how does that feel? He's doing it a few times to check and see. And then I'm asking him to turn his to bend his head to the side. And I notice how he's shrugging his shoulders to do that. Many people do this to make it look better, feel like they're doing more motion. And then I'm giving him a stretch for the upper trapezius muscle to stretch out this tightness that I was working on a lot. And with this stretch, we want to hold it. In order to get a good stretch, I usually recommend 20 to 30 seconds of holding it. And then I'm asking him how it compares when he stretches one side versus the other. And I'm asking him to add this to the exercises he does at home.